I'm Dr. David Beaulieu with more news you can use. And recently, I've had a couple of patients ask me if I could give more information on neuromuscular biofeedback reflex technique, which is a form of muscle testing. And how does it work? What's really going on there? What are the doctors accessing? And I think probably the best explanation is an explanation by a medical doctor, psychiatrist, who also held a PhD. His name was David Hawkins. He has since passed away, but his very famous book, The Power of Thought, had this to say: the individual human mind is like a computer terminal connected to a giant database. Now today in quantum physics, we would call that the universal field of energy and information. Some of you might call it God. The database is human consciousness itself, of which our own cognizance is merely an individual expression, but with its roots in the common consciousness of all mankind. This database is the realm of genius, because to be human is to participate in the database. Everyone, by virtue of birth, has access to genius. The unlimited information contained in the database has now been shown to be readily available to anyone in a few seconds, at any time, and in any place. This is indeed an astonishing discovery, bearing the power to change lives, both individually and collectively, to a degree never yet anticipated. We at the Essential Care Centers of America utilize neuromuscular biofeedback because it allows us to access this information database. It eliminates so much of the guesswork called diagnosis in the care of our patients. We go right to the source, we get the information, we get the answers, we find out what's needed, we make the changes, and we see the positive patient responses. It sure makes taking care of sick people a whole lot easier. How's that for an explanation?